Diabetes, proper foot care is very important. Poor foot care may lead to amputation of a foot or even a leg.
People with diabetes are more vulnerable to foot problems. Joining us now to talk about that, Dr. Robert Boudreau, podiatrist with East Texas Medical Center. Nice to see you
Morning,
again,
doctor.
sir.
Good to see you.
Quickly, let's review how serious a problem. When you think of diabetes, of course, you think of childhood diabetes and you think of type 2 diabetes, which is rampant these days. How serious a problem is this stuff?
It's a very serious problem, and it's growing in its magnitude. 8% of the population is diabetic, and an increasingly number of our children are becoming diabetics because they're more sedentary. They sit around and watch TV, play on the phone, eat stuff they're not supposed to, don't get any exercise. So it's increasingly, and we're seeing a lot more in the younger generation nowadays.
Now, you think it'd go to the full body, but why especially the feet?
Well, it does affect the full body. It affects the eyes and the kidneys, but it affects the feet specifically because you lose circulation and you lose nerve supply, which is called neuropathy. And once you lose that nerve supply, your feet are more apt to have injuries that you can't even sometimes know about.
I see this affecting a lot of times more. Obviously, you think about people who deal with type 2 diabetes. Sometimes they're not able to see their feet as well as perhaps some healthier people can.
Right.
And obviously, people who are getting on up in years may not be able to give their feet a closer inspection as well. And getting someone to take a close look at your feet is obviously critical in something like this.
It's very critical. You know, as you said, if their eyesight is gone due to the diabetes or arthritis, or if they're a little more obese than they're supposed to be, it's hard to get down there to them.
Right.
We do recommend that they check their feet every day, and if you can't see it yourself, either get a spouse or a family member, or just put a mirror down and look at your foot in a mirror.
Yeah.
I also recommend that my patients will, if they can, if they're having a problem, take a picture of it. Sometimes you can glean a lot just from looking at a picture of a patient if they're not able to come into the office.
Now, what shoes do you think that they should wear?
The main thing is to wear a proper fitting shoe. I don't tell people get a certain type of shoe. I just tell them wear one that's comfortable. Should have plenty of length, about a thumb's width between the end of their toe and the end of the shoe, wide enough so that their toes aren't crunched together and causing corns and calluses and things.
That's an easier sell for guys than ladies, because ladies you always wear uncomfortable shoes because of how they look, so that's a tough call. Obviously, when you're diagnosed with type 2 diabetes, I mean, getting to someone like you, getting to a podiatrist is paramount, I would think.
It is. Not? We recommend that they see their podiatrist at least once a year. Hopefully their primary care doctor is checking their feet in the interim, but we recommend a yearly foot exam to make sure that, number one, to establish a baseline that we can compare things to, and then from every year in the future, we can check and see, has their circulation decreased, has their nerve sensations decreased. We check all these things very closely and keep a close watch on it, because the key in diabetes is to prevent injuries from occurring.
Doctor, surely a lot of people have some questions. How do we get in contact with you?
We have a website, ETMC.org. They can look it up on the website. We have movies available to teach people how to take care of their feet. But again, the main thing is come in for that visit so we can examine them, establish a baseline, and give them some detailed instructions on what they need to do to take care of it.
Education and preventative maintenance, that's a big deal in this thing, isn't it? Doctor, always nice to see you. Thanks for coming in.
Always nice to see y'all. Thank you for having us.
Okay.
Later on.